Thank you for joining the movement to create a world free of MS by becoming an MS activist and learning about the National MS Society's 2013 Missouri Policy Priorities. With 60% of those with MS leaving the workforce within 10 years of diagnosis, individuals with this disease are vulnerable to the loss of employer-sponsored health insurance, making Medicaid an important safety net for the MS population. I'm Rick Rovac, and this video will cover the basics of why Medicaid expansion in Missouri is vital to the health of our people and our economy. First, we'll cover a brief explanation of the Medicaid program in general, and then explore specifically what an expansion of Medicaid would mean. Medicaid is a health insurance program for low-income individuals and families. It's funded through a joint federal-state partnership with states administering the program. Eligibility is determined by income and family structure. States can have different income eligibility levels and even call their Medicaid program by a different name. For example, Missouri calls its Medicaid program Mo Health Net. Currently in Missouri, childless adults are ineligible for Medicaid. Only very low-income parents, pregnant women, children, and individuals with disabilities are eligible for Medicaid. This low eligibility threshold has greatly contributed to the problem of 853,000 individuals in Missouri being uninsured. The Medicaid expansion was designed as a way for more low-income individuals and families to access health insurance. Under the Affordable Care Act, ACA, also known as health reform, states may choose whether to participate in the Medicaid expansion, which would allow more low-income Missourians to access Medicaid up to 138% of the federal poverty level, or about $31,800 for a family of four. If Missouri were to implement the Medicaid expansion, it is estimated that 260,000 Missourians would become newly eligible. This will be particularly important for individuals living with MS who become disabled and lose employer-sponsored health insurance during the 2-year waiting period to become eligible for Medicare. An expansion of Medicaid would actually bring money into Missouri. The federal government pays 100% of the cost for the first 3 years of expansion. Federal support for the expansion gradually reduces over several years until it remains constant at 90% of the cost thereafter. Missouri stands to gain an estimated $15.7 billion in federal matching funds between 2014 and 2021. In 2014 alone, this influx of federal dollars would result in approximately 24,000 new jobs in Missouri's healthcare sector that could never be outsourced. When health reform was passed, it was intended for all states to participate in the Medicaid expansion. Since it was anticipated that more low-income individuals would have health insurance, the law also included significant reductions in payments to hospitals that treat a high number of uninsured individuals who cannot pay for health care. However, the June 2012 Supreme Court ruling on health reform made it possible for states to choose whether to expand Medicaid. This means that if Missouri does not expand Medicaid, our rural and safety net hospitals will face serious financial difficulties through the combination of a continued high number of uninsured patients and reduced payments from the federal government. Furthermore, states that do not expand Medicaid will, through federal tax dollars, basically subsidize Medicaid expansion in other states. In this scenario, Missourians with MS will lose in two ways. Medicaid eligibility will still be very limited, and those in rural areas may see local hospitals close. Many people and organizations across the state recognize the opportunity that Medicaid expansion presents to Missouri. Nonprofit organizations like the National MS Society, the business community, and healthcare provider groups all are mobilizing to ensure that we make the right choice for Missouri. Medicaid expansion is the right thing to do and the smart thing to do. It will create jobs, ensure economic stability, and provide thousands of Missourians with access to health insurance. For more information about this issue and other Missouri policy priorities for the National MS Society, visit our website, gatewaymssociety.org, and click Advocate.